All right, we're recording. So welcome everybody to our Zoom program today. Today we are excited to have Karen McGlynn here to talk with us about the new mask recommendations. So I'm going to turn it over to Karen and let her talk a little bit.
Hi, everyone. Thank you for having me again. So yes, there's some good news out there. As you know, we've been vaccinating since the mid to end of December, and it really picked up in January, and our numbers have come down considerably. Right now, the current active cases in the state of New Hampshire are down by over 1,700 from 2 weeks ago. That's just 2 weeks ago. So it doesn't mean we're out of the woods yet. So there's a lot of things we do for mitigation to try and beat this virus. One of them is vaccine. And by using different methods, our goal is to get, watch our numbers to make sure they get down where we want them to go, downward trending, which is, like I just said, positivity, the positive active cases, the positivity rates, the death rate, things like that. So one of the measures we use is called test positivity rate. So basically it's the rate of all the tests being done that come up positive. And right now we're at 5.9, and back in December 31st, we were 9.4. So that's a huge decrease. In epidemiological terms, the goal is to get below 5, and we're at 5.9 as a state. So statewide, we're doing really well. Pelham-wise, we need a little work. Where the state had a steep decline in January, Pelham stayed pretty level. Then come the 1st of December, Pelham did take a deep decline, but now we've leveled off again. So what we want to see is a steady decline. So we need to work on that. Like I said, the state's positivity test rate is 5.9, but in Pelham, we're at 6.4. So we still have some work to do. So like I said, those numbers are what we watch, and some things that we do is called mitigation. Vaccine is one of those. Wearing masks are one. Social distancing, washing our hands and using sanitizer. What am I missing? All those things the things that we tell you all the time. I'm having a blank here. They're all called mitigation measures. So even though everybody's been relatively doing well across the state using those measures, people are still getting community spread, widespread. Yeah, we have some that aren't wearing masks, which is a big cause of it. But then we have a few outliers that are saying, wait, I wore my mask everywhere. How did I get COVID-19? Well, yes, we know in general. Now, remember, this virus throws us for a loop about every 2 weeks. So it's changed over time. We have new variants that are in our country now. And we have one of the variants right here in Hillsborough County. We have one case of it. So when you ask yourself, wait a minute, I'm social distancing and I'm wearing a mask, why did I get COVID-19? Well, we know that the main portions of the particles won't go further than 6 feet. But what we've also learned are there are some minute particles that will get airborne and carry further. So when 2 people wear a mask, supposedly you're 99 or 96% protected if you're social distance as well. But people are still getting it. How are they getting it? Well, people aren't wearing best fit masks, first of all. And best fit mask means no gaps here, double layer, and no gaps on the sides. So what we're finding, recently, the CDC did a study, and that's where all the hype in the media came out about double masking. Those of us in public health are pretty furious with the way the media spread it and said, everybody needs to wear a double mask, because that's not the case. it's going to be individualized. If you're wearing a mask that is more than one layer and you hold it up to a light and can't see the light through it and it doesn't gap, your mask is sufficient. If you're just wearing a surgical paper surgical mask, you need to double up. If you're wearing an N95, which is what hospital workers wear, and emergency responders, or a KN95, you don't double mask. So there's a lot of variant in there. Now, don't go into your doctor's office and see them wearing an N95 and then a mask over it and tell them they're wrong, because things are different for them. They wear their N95 all the time, the whole time they're there, and they don't change it. So in between patients, they have to change a thinner mask over it. So everything I'm saying doesn't really reflect on them. This is for the general public. So the CDC did a test in a lab. They did a lot of research and it was published in the journal. And it showed they had mannequins, they had people, and they simulated COVID with smoke and where it comes out. And it does come out through the tops if you don't have that strap formed. It does come out here, and some of it comes right through the mask. So it explained the unexplained community transmission. So that's the basis of why the news is saying this. So what they do want you to do is, if you're wearing a paper surgical mask like this, okay, they want you to do a technique called tuck, knot and tuck. And I'm going to try and show you really quick. Okay, so first thing you do is you're going to make sure it's pressed on your nose so that it fits. Okay, you're just going to fit it like that. Then you're going to take it by the edges and pull it together. Pull your string up, and it's simple. You're just going to make a knot as close as you can right to the material, and pull the other end out. There, you see that? Simple knot. I'll do the other side real quick and show you. So that's the knot part. And then the tuck part is below it in the mask. Okay, so there you have it. And here's my bend in my nose. So you have a secure fit and it's very well around. However, you still have this part right here. So basically all you're doing is tucking it like that. And then when you put it on, I'm not going to put it all the way on, but you can see when you pull it tight, it actually closes right up. So that's the knot and tuck method they want everybody to use if you're using this type of mask or any kind of mask. And then a cloth mask over this if you're in public and you can't social distance. If you're in the grocery store, if you're in any place where you can't get 6 feet. Another reason for this is the variants. Okay, let me tell you about the UK variant. Is the first one we found. There's multiple variants now, by the way. There's a bunch of them. What we have in the United States is we do have several cases of the Brazilian variant, we have the UK variant, and we have the South African variant. The UK variant is in Hillsborough County, so it's safe to assume it's elsewhere as well. And it started out with a person who had contact with someone who was out of the country. Simple as that. It is 70% more contagious than the current COVID-19 we've been dealing with. 70%, which is why they need the push to add another layer of this mitigation that we're doing. A lot of people are saying, oh, well, I got my vaccine, I can burn my mask. Absolutely not. The whole idea is to put all these different mitigation methods together until we beat it and it's gone. For example, if you look at a virus that is less contagious, less severe, and you do mitigation like that, it almost disappears. One of the examples I'm going to give you is the flu this year. We see almost no flu this year. None. We've seen very little upper respiratory issues other than COVID. We've seen very little pneumonia other than caused from COVID. All of these things that typically we'd see throughout everybody all during cold and flu season, we're not seeing. We're using masks and people got their flu shot. So it's harder with the COVID because it's more contagious, it's more severe, and it's more dangerous. Will the vaccine we have now work with the new strains? So I'm getting a lot of questions about that. We do know that it works on the UK variant the same way. The Brazilian, not so much. South African, not so much. But what we do know is it does have the potential to decrease the severity of it. So you may get it, but you may not end up in the hospital, or you may not get it as serious. They are working with the vaccines, trying to alter them, and maybe we'd end up having a booster. We don't know. We just don't know. And what we do know right now is the vaccine's only good for 3 months. We don't have any other data to say otherwise. We got to wait for people that have been double vaccinated 3 months down the road to see if they still have the antibodies. So, like I said, this is evolving. It's going to continue to evolve. We are hoping, I mean, they've already lifted some of the restraints for quarantine. If you've had your double vaccine and you're 2 weeks out from your second vaccine, you have 6 weeks where if you're exposed to someone with COVID, you don't need to quarantine. But what 6 weeks? Maybe by the time you hit that 6 weeks, we'll know more about how long it'll last. So cross your fingers. There is some hope out there. There is some talk that they are looking at one of the vaccines lasting at least a year. It's promising. I think it's the Moderna, not 100%, but I think that's the one. It's either Moderna or the Pfizer. So stay tuned. We're continuing, getting the information. They're doing the studies, and that's all we can go with right now. So if you have any questions, I'd be happy to answer them.
Does anyone have any questions that they would like to ask Karen? You can certainly take yourself off mute. Paula, do you have a question? You have to unmute. We can't hear you.
Sorry, I thought I did. Sorry. On the paper masks, and you said, that on certain occasions we should wear a double mask. Are you saying a paper and a cloth, or can you wear a double paper?
Sorry, I should have clarified that. That's one of the don'ts. You do not wear 2 paper masks. It makes it difficult to breathe. It's always a paper and a cloth.
Okay, thank you.
You're welcome. And if you have a cloth that has 2 layers, you don't need to double up.
Oh, okay.
As long as there's no gaps. We just want more than 1 layer. They really recommend also no more gaiters. Those things people pull up.
Oh, yeah. Mm-hmm.
Yeah, because it's too much of a gap here, and then it falls here and people leave it. And most of them are only 1 thin layer anyway. And if it's 2, it's still very thin. Thank you for bringing that up. I left that part out.
Does anybody else have any questions, whether it be about the masking or questions in regards to the virus? If you do, go ahead and ask.
Nobody else? I'll ask another one.
All right, Paula, you're up.
On the vaccine, you said right now they think it only lasts like 3 months. If it only lasts 3 months, and you probably don't even have an answer, does that mean we have to go back and get vaccinated again?
So if it only lasts 3 months, and the only reason they're saying it only lasts 3 months because we only have data for 3 months.
Okay.
There is a possibility people would need a booster. But what that booster looks like and how far out, we don't know yet.
Okay, but it would only be a one shot
for them.
booster?
Yeah.
Okay. Okay, just curious, that's all.
Remember, boosters are to cover what the rest of it doesn't. Like your first shot, you're about 40 to 60% covered. Your second shot brings you up to 96%. But if that dwindles down, you might need a booster to bump it back up until we get beyond this thing. It's not a quick fix. The last time we were in a situation like this, it took 3 years for our country to get on the other side of a virus. So just so you know, hopefully it won't take that long. We're already a year in.
Yeah, I mean, I think that's such a hard thing for folks to swallow. But I think as long as people continue to do these mitigation, like you said, the 6 feet, wearing the masks, getting those vaccines when possible, keeping yourself healthy too, so that if, like, God forbid, you did get the virus, it either may not be as severe, or you may not see those symptoms as if you were on, in one of those higher risk categories. So trying to keep yourself as healthy as possible is good. It's so hard. I know, the problem we have is, people just are starting to get that serious fatigue. We were talking about it today at the center, that just, yeah, you're kind of in that February lull, but it's amplified because of the virus.
Right. Everybody's in because it's too cold to go out. I mean, I just went to the doctor and she's like, "Are you outside getting some exercise?" I'm like, "No, I don't like 20-degree weather. I have a bike upstairs. If I want to get on my bike, I'll get on my bike." But with that comes a little bit of mental therapy. If you can get outside and get some fresh air, and I mean, everybody's happier when the sun is out.
Mm-hmm.
And then you put COVID on top of it. It's difficult for a lot of people.
Mm-hmm.
The only thing I can say to that is keep doing what you can do to keep your mind, body healthy, and just kind of push through it. We're actually, coming down the other side of it, believe it or not. We are. By seeing these numbers, I mean, the numbers are great, but the most important thing is the death rate. And that is dropping drastically.
Mm-hmm.
So the seniors are the age group that we're dying the most, and they're the first to get vaccinated, and we're seeing the progress. So
yeah,
keep your fingers crossed.
Now, Karen, well, I've got you for a minute. So, I mean, you're real familiar with the mitigation that we're doing here at the center. I mean, I've been very proud of our folks here in regards to, making sure while they're participating in programs, they're keeping their distance, they're wearing their masks. A lot of folks have their own masks. Do you think I should have the surgical masks here all the time for folks?
Yes.
Yeah. Okay.
Yep.
So,
And we talked about this last night at my other meeting. Honestly, to be honest with you, I think our world has changed in a lot of ways permanently. I think you're going to see a lot more people wearing masks even after we get on the other side of this. They're going to be, I mean, just look at the flu. It's gone, When people travel, you're going to see a change. You're going to see changes in operational, how people do things, how businesses do things. It's not a bad idea. I think sanitizer's here to stay even more than it was previously. People that were non-believers are now believers. So do I want to live in a country where everywhere we go, we have to wear a mask? Absolutely not. But I think I'll be more conscious of it.
Mm-hmm. Yeah, because I was thinking, so I see so many different people, and even myself, like I wear a mask that I was just trying to do when you were talking, I was trying to do that knot and tuck with. And
you might not be able to.
I can't. So I'm, thinking I probably should have like an ongoing supply of those disposable masks. Because I know same thing as you go into the doctor's offices nowadays and they say, okay, take that mask off and put this one on. And so
my doctor's office doesn't do that. They don't even allow you to take it off.
Oh yeah, wow.
Oh yeah, you don't take it off unless they got to look down your throat, and then it's a boop.
Yeah, the office that when I went in, I had to have a mammogram. So when you walk into the hospital, they're like, switch this out. You got to wear this.
Because of the metal. Yeah.
Yeah, but it's like no, they wanted the metal in there.
Oh really?
Yep.
Never heard of that.
Yep, for the mammograms. I mean, yeah, but no, I had to wear.
True.
I had to wear their specific masks. I don't know, I assumed it was metal. It might have been some other material, but
Yeah.
yeah.
Yeah, because they want the again, best fit. The words are best fit.
Mhm.
That's the nice thing about the paper ones. When you do the knot and tuck and you put it on, it's a really good fit. The problem is you can see right through it. You can see right through it. So you still have to wear a one layer across it. I mean, my mask I wear across it is a 2-layer, so I'm kind of triple layered. So I get really hot. So I need to find something a little lighter. I have several, so I just need to figure it out. That's the other thing. I think people are going to start, part of their wardrobes now is going to be all their masks if they haven't already.
Yeah,
So
yeah, definitely. Does anyone else have any questions for Karen?
I
Yes.
did.
Marianne?
I did. You spoke, Karen, this
Martha.
Martha, we don't have a camera. The difference between the two serums, the Moderna and the Pfizer, what is the waiting period? If you have Moderna, how many days do you wait before your next shot? And the same with the other.
I believe they're both close to 3 weeks. One might be 10 days or 14 days. They're both very close. The biggest difference between those two vaccines is the cold storage chain. One has to be kept at a much colder temperature than the other.
And is that Pfizer that you have to wait? That the storage for Pfizer is?
Yes.
It is Pfizer. Okay. All right.
One of them, I'm not sure which one has the coldest. I just had this conversation yesterday. I believe it's the Pfizer that has to have the deep, deep cold.
I think it is too.
Yeah, I've heard that. Yeah.
Okay. Just wanted to clarify that.
And Karen, I know when Martha was asking about the amount of days. So in New Hampshire, when you go to get your first vaccine now, I understand they're giving you your next appointment. So they're automatically scheduling it within the proper time frame.
Well, what's interesting is I got mine on the 10th, my first on the 10th. They gave me a card that said your next appointment will be around March 9th. But then I got an email saying to schedule my appointment, and they scheduled at the end of March. So I was 8 weeks out. I'm still 8 weeks out, which they're trying to fix. I have my regional health department in Nashua is gonna fix that. They're just gonna get me over there around the 10th. But our public health system in New Hampshire needs a lot of work. It really does. It needs a lot of help. It needs a lot of resources that it doesn't have the money to have. And again, that's one of the things I think we'll see change.
I have a question.
Sometimes it takes a pandemic.
Yeah, definitely. Marianne, I know you have a question.
Yes, thank you. I was just curious, do you foresee Walgreens in town giving vaccines down the line?
Yes, I do.
They actually are giving them right now.
Yeah. They've started allocating. So each week, the state is receiving 10 to 11% more vaccine each week. So our amount of vaccine is building up. Now they've started allocating, setting aside a certain amount for Walgreens. But you have to go in and register the same way. And then they look at where your closest Walgreens is. And then they'll have you schedule at that point.
Oh, okay. So like I'm not scheduled till almost the middle of March, unfortunately, and due to go to Londonderry. But if I can have it done in town, of course, that would be far more convenient. But so you're saying I go in and re-register all over again?
I do not recommend that, because that's what they told me. But the only thing you can do is cancel the appointment you have, and there's no guarantee that you'll get in.
Right.
I know for a fact right now they're booking out into April. The only way I would recommend is for you to call 211 and try and talk to somebody and have them change it. But that's a wait. You will wait. Like I said, the system is broken.
Okay.
But that's the recommendation the state is saying, call 211. I wouldn't recommend you cancel it. It won't, VAMS will not let you reschedule without canceling your current appointment.
Okay, gotcha. I'm not gonna touch it then.
Yeah, no, I wouldn't.
Karen, I've spoken to a bunch of seniors that actually several that were booked out in April for their first appointment, and they were notified.
Yes,
And they were called and they
Yep.
said, we can get you into Walgreens in Pelham on Thursday, like this week.
yes.
And they're like, okay, so if they,
So what they're doing
go-
is, first of all, when they set a vaccine day, only 10%, there's 10% of people that actually don't show up. So they end up with some vaccine. Now the Moderna can sit 5 days and still be fine. So they'll reschedule people to get them in quicker to fill those.
Mhm.
They'll also, as we get more in each week, they open up more windows. So they're manually going in and trying to find people like the seniors and bump them up.
Mhm.
So it's possible that you'll get bumped up, Marianne.
Oh, okay, thank you.
Yeah. I have an appointment. It's the last day in March.
Mhm.
And I did try calling 211.
Mm.
And I really, the first time I called, I got absolutely nowhere. The guy, sorry, can't help you. That was it. I ended up calling the health department in Concord. I was on hold for I can't tell you how long, but I did get a very nice person that kind of helped me a little bit. So I called 211 again, and I got a very, very nice gentleman. And the one thing he did recommend is do not cancel your appointment.
Right.
He said, and I can send you over to the scheduling. He says, but I'm telling you right now, they're scheduling out to April.
Yes.
Now, my question is that you're saying that they're calling people in, but how are they doing that? I mean, like, I'm March 31st, but if
But
they're
if-
calling people in from April, then they're not going to call me in. And
Right.
as people are calling up to get appointments, they're taking the earlier appointments.
No, they're not. They're not. The way they're doing it is they're going down the list starting today.
Mhm.
Okay.
And
all
they're
right.
looking at your age
Uh-huh.
and your risk factors.
Okay.
And they will call you. They're not calling the people that are in April. They're calling the people that are already registered from here, from today on.
Mhm.
Oh, all right. Okay.
And
So
they're
there
pulling
is a
names
change.
and they're calling them.
Okay. Now
Yeah.
I am scheduled to go to Londonderry, but if
Yeah.
they call me in, is there a chance that they would call me in for Walgreens?
There's a
Oh,
chance they could call you in for Nashua. There's a chance they
Okay,
could call you in
alright.
for Walgreens. It's
It doesn't
anywhere
matter. If they
close to
call me,
you.
I'll go.
Right. And that's what we're finding too. Yeah.
Yeah.
Like they're going to give me probably an hour's notice because I'm going to just slide into where somebody didn't show up.
Mhm.
Right, right, right.
So-
Now, if they call you, and let's say, because most of the time, four mornings out of the week, I'm usually down at the center. So if I'm down at the center and they call my house phone and I'm not home, they're not leaving messages, are they?
Nope, you're out of luck.
Oh, well,
So
no,
hopefully you
okay.
gave them a cell phone number.
I think I did. Yeah, I did because I've gotten texts.
They will try your cell phone.
Oh, okay, good, good.
Yeah.
Okay. Thank you.
You're welcome.
Janet, did you have a question?
How will we recognize the call? Because if I don't recognize the number or the name, I don't answer the phone.
I couldn't hear the question.
She was
Well, I'm
asked,
Sorry, I turned it down. Hold on. How will we recognize the call? Because if I don't recognize the number, I don't answer.
All it will be a New Hampshire or a Concord number. So
That's
That's the
that's
problem.
bad because I don't
Yeah.
answer my phone either.
yeah.
I know.
Yeah, so what I would recommend you doing is if there's a Concord number 271, so that's typically your Concord, your state offices or
I think it's 603.
no, 27, it's like 603,
Oh,
271.
yeah.
Oh.
Yeah.
So
Okay.
the Concord Exchange is 271. So if you do see a New Hampshire number, 603, 271, blah, 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 chances are that's going to be them, like she said, or New Hampshire. If you pick it up and it's like, I don't know, I can't tell you how many times a day I get we've been trying to reach you because
Yeah,
of our warranty.
just hang up.
Right, yeah.
You know, you're better off taking the chance that it's a human being saying, hi,
Right.
I'm so from the New Hampshire State Department, health office, and I want to reschedule your appointment. That, you know, I would take that risk in the next month and a half.
Yeah.
Yeah.
And do
I'll
that.
do
Is that how they're gonna identify themselves as being a health, you know, from the health department?
So typically, if they're gonna move you up and it's not urgent, like within an hour, you will receive an email.
Okay. Mhm.
And it will explain in there, the email usually comes from called the CDC.
Right.
And it will explain to click on the link and move your appointment. However, if they call you, nobody knows. Just answer your phone.
Okay.
Okay.
Just
Talk to
don't
some
ever say
interesting
yes.
people.
Yeah,
Yes.
I think they do identify themselves with the Department of Health and Human Services. I had one senior, they had a snow, their appointment was scheduled for a day that the clinics were closed because of the storm. And they just called her back and said, we can get you into Walgreens over in Pelham if you can come tomorrow. And she was like, okay. And she went and she was on the list and it was all legit. She was like,
But
know.
I will tell you, there has been a scam here in Pelham
Oh,
where somebody has been calling seniors and saying, for a fee,
Yeah.
I can get you into Walgreens.
Mhm.
Do not ever believe anybody that says you have to pay a fee to get your vaccine. It's free to you. It's free to go do it. Just hang up on them and report it. Report it to me or to Chief Rourke over at the police department.
Good
Does
information.
anybody else have any questions? Does anyone else have any questions for Karen? Janet?
I have a question on a totally different subject, if you wouldn't mind.
Sure.
I heard there was a case of Cratesville Jacob in Pelham. Can you comment on that? Do you know about that?
I can't comment on it.
Okay.
I apologize.
I just wondered if there was any public information coming out.
Not yet.
Okay, thank you.
What is that?
What is that?
Yeah.
It's a rare disease.
Oh, okay.
So, anybody else have any questions in regards to COVID or?
Oh,
Okay.
we have a story about 211 and what happened in London area this morning.
Ooh,
Sure.
please tell.
Oh, we had our appointment a few days ago
Valentine's Day.
on Valentine's Day. And we were scheduled to go up there at about 9:10 this morning. We got there ahead of schedule and there was a reasonable sized line, but it moved along quite well. We were only in line maybe 20 minutes before we got to the station where we got into yet again another line in order to wait for somebody to come around and ask you questions and check your ID and that. So within a half an hour from passing the first gate, we were receiving a shot. The little problem was that they didn't have our names on the appointments list for 9:10 today. I don't know whether that was because we called 211 and somehow the left hand didn't talk to the right hand or whatever. But anyway, they took care of it all, straightened it all out, gave us the shots, gave us clearance for 15 minutes to leave, also gave us the card for our next shots appointment, which was exactly the same day, 1 month later.
Good. Has anybody gotten their second shot yet?
That was our first.
Okay. So one thing that definitely with the Moderna, the first shot, typically what we're seeing is people they're having very little to no side effects.
Right. Mhm.
I myself felt just very tired and I did have some joint pain. But I will tell you the second shot will be different for 95% of you. Well, hopefully the 5% of you won't be will be feeling fine. About 12 hours after your shot, you're going to feel like you have the flu, and that's okay. You may have chills, you may have a slight fever. If your fever goes over like 100 and gets to like 102, you want to call your doctor. But you will have a low-grade fever. Some people are complaining body aches, touch to your skin hurts. It lasts 12 hours and then you feel like nothing's ever happened. That is a natural response for your body building up a defense like that. That's what this vaccine does. It's not a live virus. It's a protein being put in your body to make your body build up a defense against the virus.
Mhm.
So it's very normal. Just be prepared. Don't make any plans. 12 hours after you get it, you're going to feel like crap. Take some Tylenol, go to bed, and you'll be fine.
We've felt that way before.
Yeah. I usually do with the flu shot.
I guess the second shot has a significantly different concentration to it. You get those side effects.
No,
Yeah, I don't know if it's different. I think it's just your
couldn't hear him.
body's. He was just saying
System.
he was wondering if there's a different concentration for the second shot.
No.
Different
It's
amount.
exactly the same.
Yeah. It's just your body getting that much more of it in there to tell it, okay, there's my trigger. It's time to do something about this. Let's build up a defense.
Oh, okay.
Just kind of kicks it into gear.
Okay, so it's just getting acclimated.
Exactly. This is just a precursor.
Does anyone else have any questions for Karen before you let her
I have
go?
a-
Dawn, you have a question?
Yeah. Okay, I have an appointment on March 16th. It's at 36 Riverside Street in Nashua.
Yeah.
I
It's
know where it is. What is it? What is
Nashua High
that?
School South.
Okay, the high school. I didn't know that. That's why I
Yeah,
was curious.
and you just
Okay.
drive around to the backside, you'll see all the signs, and it's just drive up, you park in the parking lot, they come over, they stick you, you wait 15 minutes and off you go.
Oh, great. Okay. Thank you.
You're
And my
welcome.
daughter lives in California. She's a vet. She's actually had both shots. The second one, she said she had a headache and she was more tired. So it definitely reacted more than the first time.
Yeah.
So, but she was fine after that. Yeah.
Yeah. Yeah. And I get my shots at South High School as well. So it's very easy. They're wonderful over there.
Great. Okay.
Yeah.
Says something's
And
wrong.
any-
Yes, it
anybody
is a
else?
battery. Mhm.
Does anyone else have any questions for
No,
Karen?
just give me the purse. You'll never
Anyone
find.
else? Okay, I don't see any more questions for Karen. I do want to thank you so much again. You've been so wonderful to have on staff during this whole thing. I know I've mentioned this before, but we're very lucky here in Pelham to have you, such a knowledgeable health officer
Thank you.
during this pandemic. It's been a great help for the center, for our members and for the community. We're very lucky here in town. We'll probably like to maybe in a couple of months, maybe we'll have you back again, unless there's any significant developments, and then I'll grab you short notice and say, please come.
Sure. Yeah, no problem.
But I really do appreciate your time. You've been wonderful.
You're very
And,
welcome.
I'm going to stop the recording. So let me get that stopped. Here we go.